My name is Eskild Petersen. I'm from Denmark, and currently I work in Oman for the first 3 years as a clinical infectious disease specialist. And since the 1st of February I moved into the Ministry of Health to work on, for instance, the national TB plan, the national malaria plans. The main difference between the Nordic countries and Oman or the Middle East is the migrant population, where we have millions of migrants in the Middle East, and they all come from high endemic tuberculosis countries. What we're doing right now is not efficient because you rely on the judgment of the person who identifies the migrant. And then we take a chest X-ray, and the chest X-ray basically diagnoses open TB, not latent TB. So we are not at all addressing latent TB at the moment. QuantiFERON test measure your immune memory to TB. So it shows that your body has seen a TB bacteria sometime during your life. So that is latent TB. So it's not a test for active TB, it's a test for latent TB. What we have seen several times is that we do screening primarily with an interview and perhaps a chest X-ray when a migrant comes into the country. Sometimes we diagnose the same person 4 years later with a fulminant double-sided open pulmonary TB. If you had tested this person at immigration for latent TB and treated for latent TB, you would have prevented an open TB 3 or 4 years later, and you would have prevented a lot of people being exposed. The migrants in the Middle East all come from high endemic countries, defined as countries with more than 100 cases per 100,000 population per year. So you have a pool of patients, or not patients, but migrants who has a much higher burden of latent TB compared to the national population. So we have to address that in some way.
QIAGEN.
Sample to insight.